Hello and welcome to Research Roundtable. My name is Annette Brown. I'm Principal Economist at FHI 360. Today we are going to be talking about an article titled Generating Charisma, Development of an Intervention to Help Women Build Agency and Safety in Their Relationships While Using PrEP for HIV Prevention. And this was published in AIDS Education and Prevention. It was authored by Miriam Hartman, Michelle Lanham, and some other co-authors. And I'm here today with my FHI 360 colleague, Michelle Lanham. Welcome.
Thank you.
So, in the HIV world, we have a lot of acronyms.
Yes.
So I do want to turn it over to Michelle, but before I want to just make sure that we have a couple of the acronyms clear. So one of them is this word PrEP that we heard in the title, which stands for pre-exposure prophylaxis. And these are methods that people who are HIV negative can use to prevent themselves from becoming positive. And many people might be familiar with the pill for this, but there are other methods as well, including microbicides. And that leads us to what charisma means here, which is, it's actually an acronym for the program, and it's Community Health Clinic Model for Agency and Relationships and Safer Microbicide Adherence. Great. All right, so Michelle,
Yes.
One of the reasons I really wanted to focus on this article is because it's formative research. And that means that instead of just research about what's going on or evaluative research, it's research specifically conducted in order to inform the design of a program.
That's right.
And I feel like it often gets short shrift, but you've done some really interesting formative research here.
Thank you.
Can you start by telling us what your research questions were?
Absolutely. So the goal of the charisma intervention is to help improve women's adherence to PrEP. And adherence just means taking it as it's prescribed. And PrEP is revolutionary because for the first time, we have an HIV prevention option where women get to decide whether they're going to tell their male partner that they're using it. We haven't had that before, and it's a big deal. But we live in the real world, and unfortunately we know from previous research that we have conducted and others have conducted that male partner support still has a big influence on women's ability to use these products.
Yeah.
So that's why we wanted to develop the charisma intervention. And we knew that that intervention would have two components, one specifically for women and one for male partners. And so our research questions align with those two focuses, or whatever it is.
Points,
Yes. So for the women, we wanted to know, how do we support these women to use PrEP successfully, understanding these relationship dynamics that they're navigating and even violence they may be experiencing. And for male partners, how do we best reach male partners, because that can be a challenge, and what kind of information and questions do they have about PrEP?
Great. And so for this research, you were actually able to use quite a bit of what we call secondary data, meaning data that were collected in other studies, and you're reanalyzing them for this purpose. So tell us a little bit about where these data came from and what you were able to do with them.
So these were quantitative and qualitative data that were collected as part of 3 PrEP and microbicide trials that had tested the safety and effectiveness of these products: vaginal ring, vaginal gel, oral PrEP. And so we had a lot of data to work with. And in terms of quantitative data, that included tracking social harms, which are negative consequences that women experienced while participating in the study. And we also we did a statistical analysis of those social harms and some modeling of the impact of those social harms on adherence.
Great. And then you also had qualitative data from these prior trials.
That's right. We had a lot of qualitative data, in fact. We had 244 in-depth interviews and 64 focus group discussions with both trial participants and trial staff.
That's a lot of qualitative data, and you actually were part of those studies and helped collect that data, right?
Yeah, me and my
So, great. So then how did you analyze all of those qualitative data?
So it was interesting because the interview guides weren't the same across the studies, right? But we did have some similar topics, and so we used codes that aligned with our research questions, and we applied those codes across the different transcripts and studies. And then we analyzed them and came out with themes to help develop our research, to help answer our research questions, rather.
Great, great. So you have all of those data in that analysis.
Yep.
Tell us what you found and how that affected the program.
So I'll talk first about the data that affected what we did for women in the intervention. So we saw in the quantitative data from one of the trials that not disclosing, which is not telling your partner that you're using the product, so that you were using PrEP, was associated with experiencing social harms, which are those negative consequences.
So, but not that every woman who didn't disclose experienced violence, but there was a correlation.
There was a correlation.
Okay.
That's right. And those social harms can include violence. And we heard this also in qualitative interviews, that if a woman hadn't disclosed or told her partner she was using the product, and then later he found out, that can be a reason for the partner to react negatively or even violently. So based on that, we decided that we really needed to develop counseling specifically on this process of how to tell your partner you're using the product. And just to be clear, we're not telling every woman that she needs to tell her partner, because each woman is their own, expert in their own relationships. What we were doing was helping her navigate that process of deciding, do I want to tell him? And if I do, how do I do that?
That's great. That's great. So that's kind of the women's side. Tell us about the man's side.
Sure. So we also saw in the quantitative findings from one of the trials that women who had unsupportive partners also seem to have lower adherence. And so this just adds to all of the evidence that we have that male partner support is really important for women being able to use PrEP successfully. And we also heard that there were very few men that actually came to the clinic, only about 9 to 13%, depending on which trial.
Not surprising.
Not surprising, right. So the trial staff said you really need to go out into the community where men are. So that's exactly what we decided to do. We went out to soccer tournaments, we went door to door, we went to other places where men gather. And from the interviews, we learned some of the key sticking points that men had about PrEP, and so we were able to develop messages to address those key concerns of theirs.
That's great. That's great. So you did all of that with secondary data, but you also went out and collected some data specifically for this, some primary data. Can you tell us briefly about that? Yes.
So we collected data from one of the trials from women who had experienced social harms and women who had not experienced social harms. We wanted to understand more about their experience with their male partners and using the product. And so what we found that was most notable in that was that even among the women who had not reported social harms during the trial, most of them had experienced some kind of violence in their life. And so what this told us was that we really needed to screen all women for intimate partner violence, all women who are going to be in Charisma. And then it would be also important to have counseling to specifically address violence with these women and help them safety plan and help them figure out how to navigate that.
Right. And so part of this was developing a tool in order to be able to do that, right?
Exactly, yes. So we developed this healthy relationship assessment tool, or we call it the HEART tool. And it not only screens for violence, but assesses how supportive or unsupportive a woman's relationship is to help guide the counselor in how they talk with the woman.
Great. And I want to just highlight for our viewers that the research for the development of that tool, which is also discussed in this article, is really interesting. So suggest that you take a look at that. So this is really great, Michelle. Thank you for sharing this formative research with us. Before we close, are there any next steps here?
Yes. In fact, we have pilot tested the Charisma intervention with women in Johannesburg, and now we're doing an RCT, or a randomized control trial, with 400 women, and we should have results middle of next year.
Great. So thank you very much for joining us here at Research Roundtable to talk about both this interesting research and this interesting intervention. For our viewers, if you have any comments, join the discussion, and we hope to see you for the next episode of Research Roundtable.